actually, so before I actually get her, I feel like I misplaced my stuff. So now I'm gonna have to really look for it, because this is my basket right here from last year. Not from last year, from March. This is my progesterone oil right here that doesn't expire until December. So it is November, so I'm going to use this up now. So this one says December too, so I'll probably not be able to use this one because I don't want to take the chance. I'd rather just use the fresh stuff that I got. But since it's still November, I'm going to use this one. So I'm going to try and show you guys, just in case you guys are not familiar with how to do the oil, and this is why you're looking at the video. So this is brand new. This is the one with the sesame seed oil. So you just pop off the top like that, okay? And you can't put the cap back on, so you just throw it away. And then I'm going to get my needles ready too. And so usually you guys could see like the counter and everything because the way I had it. So I apologize. I'm not going to be able to do it. So you need 2 different needles. So here's a smaller one. And then this is the bigger one. The bigger one is to get the oil out. So what you do is you take an alcohol swab and you clean the top. Even though it's brand new and open, you just still gotta clean that top. Alright. Then you take, and I am taking a half. So this is a milliliter. So usually I would take a whole, which is right there. But today I'm only taking a half. So is that much? So not much. It's kind of like, is it worth it? There's like this big ass needle in my ass for just that little bit. But you gotta do what you gotta do. So you take it off. Sorry, the lighting in here is poor, but alright. So and then you stick the needle in the top, in the circle. There's a circle. And you stick it in. Then you tip it upside down and you fill it to the half. This is really hard to get out, so you just gotta really kind of like hold it and then try and not get any air. Like a little bit more. There we go. It's a little over, but that's alright. So there's like a little air bubble, so I did go a little over the half, so this way I can just push that air bubble out. There's a lot of stuff coming out. That's okay. So the needle you're gonna use anyways. Actually, I just realized I messed up. So we have to get some more in there. Because the stopper is actually right there. And I'm actually gonna push it inside here to get the air bubble out. And then pull again to make sure it's exactly on half. There we go. That's how you do it. My bad. So then I put the cover on here. And then I draw this back some to let the fluid down. That way I can change the top. And then I get the smaller needle right here. And you twist this one off. And the reason why I pushed it down to the bottom is that way the oil don't come spilling out when I twist this one off. So I twist that one off, and well, I gotta put it in the sharps container, but and then I just put this one, twist this one on, and then I just push up, back up to the half. Okay. So it's back up to the half. A little bit did come out. That's all right. But now what you want to do is you want to stick it under your armpit for like 10 minutes to get it warm. So that way it's not going in like a solid oil. You want it kind of liquid, you know, like what happens with the oil when it warms up. So that's what you want it to be, so it don't hurt as much. And trust me, it works. So I'm just going to warm this up. I'm going to clean up my mess, and I'm going to call my mom. So as I was waiting for this to warm up, I was freaking out on where my supplies was that I just got. I couldn't remember what I did with it. Crisis averted. I found it. So now what I'm going to do, since now I'm finally starting it, is I am going to get rid of this. This is full with needles from Willow. So this also included my retrieval. So I'm going to finally get rid of this one. And then replace it with a new one. So. There we go. And then my extra dye, my endometrium, I'm going to stick that over near my where I keep all my my pads and my pregnancy tests and all that stuff, so that way I have it handy for the morning. And then the needles they sent me are different. They sent me just the plunger with 2 sets of needles. So I got the pink ones here and the gray ones here. So I think, trying to think what to do. Are these milliliters too? Yeah, these are milliliters too. I think I'm just going to add it and use the old stuff first because needles don't expire. So that's what I'm going to do. And then here is my 3 brand new progesterone oils. And these don't expire until December of 23. So when December hits, I'm just going to toss those December ones out. And then just start using the new ones. So I don't know how much of the December ones I'll use before December 1st. Because it's, what's today's date? Today is the 17th. So I might be able to use both vials before the 1st. If not, then I'll be already on the 2nd vial, I think. I think so. So these are my intermediate. I'm going to put them right here. So now I have my box with all my new stuff in here. I do have these, the Ganirelix, and I wish I could give these to somebody because they're unopened and they let me see what they expire. They were filled. On March 12th of 21. I'm not seeing an expiration date on these. Oh, right here maybe. Oh, expires August of 2022. So it expires next August. And then the Ganirelix 250 mcgs or 0.5 m's. And I have 4 of them. And I know they're expensive. I just don't know what to do with them. If anybody knows, like, if there's like a donation center, I mean, they're completely sealed. They're the pre-done ones. I mean, I hate them just because I know how expensive these are. I just would hate to have them sitting here collecting dust. So, because honestly, I don't see me using these before they expire. Because even if we do another retrieval, we still have, after this transfer, we'll still have 3 frozen embryos. So, I don't see us using it by August. Because it's this August coming up. So, if anybody knows, let me know, because I would love to donate them to somebody or to a facility or something. I just don't know what to do with them. So, just, comment below, or you guys can find me on Facebook and send me a private message. That way, I can give them to a donation place. That would be awesome. And then I realized I have my new prescription of estradiol right here. So good thing I didn't go and get the one that's pending at the pharmacy, because this is more than enough. So this is 90 pills right here. And I know once I get my positive, they'll probably take me off the estrace, and the estradiol. All right, so I'm putting that back up there. We're good to go. And now let's give it a shot. All right, guys, so my mom's here. So, again, I don't know how much you guys really going to be able to see, because I don't have my thing that mounts the phone like I did last time. So, let me show you. This is the instructions that I still have from the first one, where it shows you where to draw and where to insert. And you have to rotate every day from left to right. So, and I like to write it down on what side. So, all right. So I already have it pre-done, warming up right here. Okay. So you looked at that first. Yep. Go ahead. You go ahead and read that. Alcohol swab right here. So there's 2 of them, one before, one for after. Yep. And it's very helpful if you have somebody massage the area for 5 seconds or whatever the case is, like a minute or whatever. It really does help. I know a lot of people say about the knots. I did not have knots at all. And my mom gave me my shots majority of the time. My husband only gave them to me a handful of times. So, and they hurt when he did it. Yeah, and I never had any issues with having a knot on my butt, like a lot of you guys complain of. So maybe this is why, because we do it differently. We do mark my butt, so I do walk around for weeks and weeks and weeks, especially if it's positive, weeks and weeks and weeks with lines on my ass, even after I shower. So, but no one's gonna see my ass but me and my husband and my mama.
What side are we starting with first?
We start with, where's the side? The right side?
Yep.
So start with the right side.
Okay. Let me look at that again.
Yep.
I'm sorry, I just want to make sure I'm getting it right where.
All right.
Your crack is right here, so it's right about there. So it's right here. Okay.
You're not going to draw the lines? Just going to draw a circle?
Well, I know the line. All right. You know what it is? You have an indent right here.
I know. You try to always avoid that indent.
I know. That's where that is actually halfway to your bum. So.
I know, but don't you supposed to draw like a cross?
You don't need to, because.
Okay.
I don't need to, because I see it.
Okay.
And I've been doing this.
She's a professional.
I am.
Oh shit, you need this.
Yep. I'm just making sure I got it nice and clean.
We're only doing a half today.
So I'm putting this whole thing in now.
Yes,
right?
yes. Okay. Remember what they said?
I know. I got to push it in, and then I got to pull out some of it to make sure that no blood comes out.
Like
stretch it, yes. But I'm just saying.
Okay.
Is
it all the way in?
Yep.
Oh my, you're so good.
No blood.
Oof. Whoop.
You forget.
Whoop, 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 whoop,
Felt like-
whoop. Starting to burn.
You want me to take it out now?
Is it done?
Yep.
Yep. And then massage the area. Yeah, get in there, Ma. Massage it.
Am I hurting you?
No. Is it bleeding?
No? Here you go.
All right. And that's that. And then, just in case you guys couldn't really see, you have to push it, the skin, and then just dart it, and then slowly put it in. And then she has to like retract it back a little bit to make sure there's no blood coming back through the needle. If there is, we have to move the we can't inject. We have to move it. And then if she's no blood, she's good to inject. And then you take it out with a wipe, massage it a couple of seconds, and we're good. And that's my shot. Thanks, Mom. Good job.
Anytime.
My professional over here.